Welcome everybody to Mole Rat Nation. I'm Bob Carmichael and let's get started. Testosterone, TRT for Longevity, Part 7. Testosterone Risks and Side Effects. I think this is a good time to say I am not your doctor and this information is just my opinion and not medical advice. There are two groups of people that know about testosterone: doctors and bodybuilders. Doctors view testosterone the same way they view plastic surgery. It's medical, but not really that necessary for good health. Doctors are watched to make sure they are not prescribing testosterone in unsafe amounts or for inappropriate reasons, like for high school athletes. Testosterone can have a number of dangerous side effects. In Part 1 and 2, we talked about raising red blood cell counts and hemoglobin. In Part 3, we talked about testosterone and growth hormone raising iron levels. This is why most studies show an increased risk of heart disease and stroke. But donating blood 6 times a year greatly reduces this risk. All steroids put a heavy load on the kidneys. A good doctor will check your creatinine levels and GFR levels to make sure your body can handle the dose you are on. If you lift weights, your creatinine levels will be higher than normal. You should ask your doctor for a cystatin C test instead of the standard creatinine test that is used to estimate kidney filtration rates on the standard panel. It's a much more accurate way of measuring GFR. The reason most men don't do TRT is the risk of prostate cancer. If you have an old doctor, he was taught that high testosterone causes prostate cancer. Low testosterone will protect you from prostate cancer. Giving TRT to a man with prostate cancer is like throwing gas on a fire. Surprisingly, none of these statements are today considered true. The other two side effects that worry men are BPH, enlarged prostate, and hair loss. Enlarged prostate. The number one cause is not testosterone, but insulin. If you have high insulin, the most important step in reducing BPH is to lower insulin levels. No sugar, grain products, and no low-fat dairy, only high-fat dairy. There are drugs like finasteride and supplements like saw palmetto that lower DHT. They can help with symptoms by blocking the 5-alpha reductase enzyme that converts testosterone to DHT or dihydrotestosterone. Hair loss, or male pattern baldness. Men have androgens that are released from sweat glands on top of their head that attach to hair follicles. These androgens, testosterone and DHT, cause low levels of inflammation, which the immune system mistakes for infection. The more androgen receptors on the hair follicle, the greater the chance of hair loss. This is why some men are more susceptible genetically to hair loss than others. All of these videos are available in a playlist at the end of this video. Be sure to click on it because finding playlists on YouTube can be difficult. It is much easier to find it in your history file. Also, join the nation. Click on the mole rat on the right. And thanks for watching.